important for you to at least know that one. Okay, but this is again for your background information to help you to get ready for your boards, that kind of thing. Questions on that? All right, with that said, I'm going to get into the limbic system, and I'm using some slides that Leslie gave, but I'm not going to go through all of them. We already covered a lot of the basal ganglia, so this information is good from the standpoint, if you guys ever go into advanced imaging, and it comes in different forms of primarily functional MRI, they're doing a lot right now on the limbic system, which is what they call the primitive brain. And what they mean by that, a lot of the fundamental emotions like hunger, rage, sorry for saying that word, okay, oftentimes will emanate learning, memory, all comes from the limbic system. So there's a tremendous amount of research being done in different arenas. So I want to give you an overview of what some of the key landmarks are. The ones I'll point out that are important we'll kind of discuss as we go through it. The limbic system primarily is going to be the mid portion right up over here. And we'll get into structures called like the infundibulum. We'll talk about the hypothalamus over here. We'll talk about some other structures in this area that I don't quite show. Hi, how are you doing?
Hey.
Okay. So we'll talk about that during the course of today. The key structures, the hippocampus is big, the amygdala is big, fornix, infundibulum, those factory bulbs, we'll talk about those. And we already mentioned about the mammillary bodies. They primarily help us with recollective memory. Again, they help us go back in our past, and if you think of a person we saw, we remember a time, a place, location. Those little structures that are adjacent to the cerebral peduncles are really powerful, and they discovered that fairly recently in terms of how memory works. So oftentimes when you're looking at these structures, beyond reasons why patients will sometimes exhibit outrage or aggressive behavior, oftentimes it's either chemical or it could be some kind of, they think, structural issue with one of these key structures. Or when when individuals can't learn or recall details, there's many reasons for it, and the brain's interlinked, but oftentimes the hippocampus and the amygdala sometimes will fall into that arena. So again, this is more of an overview of what we're dealing with. The hippocampus is perhaps the biggest one. It has somewhat of a they call it a seashell shape over here. This is a choroid over here. You don't see it really well on this one. We'll show you better examples on the transverse. But it has that little seashell, or sea snail, whatever you want to call it, shape to it. It's located bilaterally on the coronal. And why that's important is that they're doing a lot of research on individuals who have trouble going from short-term to long-term memory. That's a complex process, but what they found is that individuals that have what they believe is structural defects involving the hippocampus sometimes can't recall those memories, even though it takes like 20 times to recall information. Those pathways are being established. Sometimes they never do, and they're finding that learning disabilities sometimes are linked to alterations of the hippocampus. So there's a lot that goes into it, but what we have found, the hippocampus is really a big part of it. Again, on the coronal, it's going to have that seashell, seahorse, whatever term you want to call it, right over here. It has a curl to it, and that would be where you find the hippocampus on the coronal. Transverse, we'll look at it here in a moment, at this right. Basically, it's kind of hard to see, but it's back over here and back over here. It's a gray matter structure. Hard to see on the sagittal, but you're going to see it oftentimes the level of the midbrain, and it has that curl to it. This perhaps could be a better image. The amygdala is found directly anterior to it, so it's going to be actually back here is the hippocampus, where that gap is. The amygdala is kind of an interesting structure as well. We find it to not only help with vision and smell, but also it mediates, regulates aggressive behavior, memories, rage, happiness. Oftentimes they're finding the amygdala is responsible for that. Again, it's a complex process, but the amygdala oftentimes, when individuals exhibit behavior of rage, of anger, excessive anger, even schizophrenia, sometimes they're looking at changes that occur in that area. And there's a lot between both the hippocampus back over here and the amygdala. They're doing a lot of research in that area to see if that might be the factor that leads to some of those outrageous behaviors. Again, these are basic or primitive reactions. The fornix basically is going to link, if I can go back, I'll show you here in a little bit the sagittal. You have a hippocampus that we'll talk about, so hypothalamus. But right over here, we look at images that begin in the upper cerebrum as the septum pellucidum, and then it begins to create a teardrop shape to it. And other examples I'll show you, it has even a V shape to it, inverted V. What you're seeing right over here is the fornix. Basically, it's going to link what we call the hypothalamus to other parts of the brain, specifically the pituitary gland, which then would produce a chemical or glandular response to different factors in terms of homeostasis, regulation of temperature, pH, things like that. So this little guy over here will be found directly below or inferior to the septum pellucidum. Here it is over here. This is a coronal perspective. Here, of course, probably would be my splenium back up here. This upper portion would be septum pellucidum. And then where that little teardrop appearance of that structure is referred to as the fornix. Again, it's going to link the hypothalamus to other regions of the brain. Olfactory bulbs, we're not going to see those structures at all. Basically, the process of smell is going to be beginning with the olfactory bulbs. These little guys are going to be embedded in the ethmoid bone. So there's two things that happen with smell. One is it's a chemical reaction that's going to produce an impulse. So when you smell something, it's going to be registered in different portions of the brain, like the temporal lobe, and it's going to bring back a memory. It could be pleasant, like a rose, or garlic as being offensive. These responses they find is learned. So, my wife always complains about cilantro. The spice cilantro? Okay. I like the smell. She can't stand it. She can't stand the taste of it. So she goes into a restaurant, she smells cilantro, turn around and leave. She has a bad memory of it. I think it's more than that. Anyway, that's part of it, and we have that sensory, but also it's going to be a impulse where you have these chemical receptors in the olfactory bulb that will be activated based on things that are offensive, that could be like acid smelling. I don't like the smell of citrus. I don't know about you guys. I smell like orange blossoms. I just can't stand it. And I lived in Arizona. And it might be because the chemicals that are found in the air may produce a chemical response with these olfactory bulbs. Basically, what's going to happen then is that these bulbs are going to go back into the first cranial nerve. We'll talk about it here in a little bit. That then will register in different portions of the brain in terms of response. The mammillary bodies, we talked about these already. When you look at the sagittal, they're little tiny jobbers. So here is the midbrain we talked about before, and it's kind of hard to see this. This is my hypothalamus and the mammillary bodies. They're going to be that little guy right over here, like two little circular dots. Better seen on a transverse image. And again, we talked about that. It's going to help us in regard to recollective memory. So again, when we look at thinking back 10, 20 years ago, you guys probably haven't been a life that long to remember that far back, but oftentimes there's going to be a person, there's going to be a thing, there's going to be a place that will produce that recollective memory, and that's going to produce longer term memory motivation, and you'll be able to recall details, whether it's a person, place, what you did, things like that. So that's going to interact with the hypothalamus. The hypothalamus is this area right through here, whereas these are the mammillary bodies kind of over here. This gray area over here is going to be the hypothalamus. Here's my thalamus, larger, paired, seen on either side of the third ventricle. Here, this little gray guy over here is hypothalamus. It's going to help us in terms of homeostasis, our sense of balance, our sensitivity toward temperature, pH change, pressure is basically regulated by the hypothalamus. It will be connected to different portions of the pituitary gland through a structure we haven't talked about yet called the infundibula. So basically, the hypothalamus is going to be responsible for that. This coronal structure here, this kind of shows you a couple things. We're going to get into nerves as an introduction as part of today's lecture. But what over here is that we'll find that the second cranial nerve, called the optic nerves, will go through a process of crossing over, desiccating, much like what the pyramids do in the medulla. Where they cross, sometimes they're called optic tracts. Other cases, they'll call this the optic chiasm, chi meaning X. So what you see over here is a pretty important level. What you have over here are the optic nerves, also called optic tracts. And then there's a connector between the hypothalamus and posterior pituitary gland, which is here. This little line over here is called the infundibula. All it is basically is a conduit a sensory connector between the hypothalamus and the pituitary gland. Basically what it does, it doesn't so much channel hormones, but it activates secretion of hormones of the posterior portion of the pituitary gland. So keep in mind, here is my optic tract, here's my infundibulum, and that's going to connect directly to the pituitary gland. So kind of know those structures if you would. Things that we've already covered will give you somewhat of a snapshot. Again, I prefer the transverse slice over here. We're at the midbrain level over here. Those little two dots right here are mammillary bodies. Here, seashell shape right over here and over here is going to be the hippocampus, and over here, the amygdala nucleus over here. So this whole area right through here really makes up a large part of the limbic system. Here on the hippocampus, it's a little bit harder to see on the side. This one really doesn't do a decent job of it. We'll get into other nuclei here in a little bit. I think the transverse will do a better job of demonstrating the hippocampus. Another perspective, we've already seen that for the most part. We have pituitary gland, we have optic nerves, optic tracts, infundibulum right over here. And what gives us that sense of space in reality is a portion of that suprasellar cistern. So it's right above the pituitary gland. So that little dark area is one of the cisterns we talked about right over here. Optic nerve we'll get into later on, not to be confused with this little small linear line back here. So what we have over here is optic nerve, right here, second cranial nerve, and then the infundibulum is going to be the small connector, which you can't quite make out, between the hypothalamus and the posterior portion of the pituitary gland. Here it kind of doesn't really show that well, but you see that little seashore shape, whatever they want to call it, on that end. I'm going to shoot through the basal ganglia. We've already covered these before. But, you know, the basal ganglia are specialized gray matter structures. Ones that we've already discussed with you would be lentiform nucleus back over here. We talked about one, but we didn't really cover it as a landmark, referred to as the claustrum. You get into the caudate nucleus over here. Structures that pretty much are seen on coronal, better seen on a transverse image. This one is more of a coronal as well. I'm going to shoot through this because we've already covered a lot of this in better detail, so bear with me. Well, let me stop here for a sec. Okay, again, this is redundant. Over here, caudate nucleus, specifically the head. This is anterior, this is posterior thalamus on either side of the third ventricle, which forms the lateral wall of it, barely beginning to transition in. We have a lentiform nucleus here. We have a lentiform nucleus here, separated by the internal capsule, external capsule, and just where we see the lateral fissure is where we would find what we call the insula. So this kind of level kind of gives you a little roadmap of most of the basal ganglia. We've already covered that to a better degree already. This one kind of shows us a little bit more detail over here. Caudate nucleus is seen over here. Here's the portions of my lateral ventricles. Internal capsule over here. Lentiform nucleus back over here. Claustrum is this little guy right there. It's one that I'm not going to get into. It's just too hard to see. But what you have is corpus callosum. You have over here what's left of septum pellucidum. Look at that little V shape right over here and here. They kind of wrap it around the thalamus, which we just don't quite see yet. This is the fornix over here, and the caudate internal capsule, and once again, lentiform nucleus. For ultrasound family, I want to talk about this briefly. It's something that I want to cover. You won't get into neuro until next semester, but with premature kids, sometimes they get because of hypoxia. We think that's the reason for it. There's a small membrane within the septum pellucidum called the cava septum pellucidum. It's around 1 millimeter in thickness. And what they think is that when kids are premature, they get hypoxic, and the germ cells within this area right through here, which is here's a long axis of the area of the corpus callosum. Below that would be the septum pellucidum. What happens is they begin to bleed, and we're not sure why, but they oftentimes will show a certain amount of hemorrhage in that space. On the next slide over here, over here, ventricle, you can see a long axis right over here, and all of this is hemorrhage on the long axis over here on a premature kid. So when you do a neonate head, oftentimes what they're looking for on a preemie would be this bleed, and what we call the caudothalamic groove. It's basically an enlarged area within the septum pellucidum, so right over here is hemorrhage. So again, when you guys are doing kids, especially in the NICU, oftentimes this will be what they're looking for if there's any signs. If it doesn't, normally it stops on its own, but if it doesn't, oftentimes you have a lot of brain development issues with it. So it's something they want to evaluate and then pretty much treat the child as quickly as they can for it. Just another one of the basal ganglia. Here's more bleeding going on. Again, here's that turf cavum, septum pellucidum right over here. So you see it's large. Normally it's around 1 millimeter. When it's bleeding, it gets a lot larger. Okay, basal ganglia, I'm going to shoot through some of these. Okay, make sure we know these landmarks. So I'm kind of run you through the loop. Okay, amygdaloid over here. These two dots over here, mammillary bodies. Okay, back over here, it looks like we're getting into, I can't see where that number 3 is. I have it keyed in.
It says hippocampus on your slide.
Hippocampus?
Yeah.
I think I'm off base on that one. I think that's number 3.
I
think what happened is my line moved on that one. Here, so that one, I'm not sure. Here's the septum pellucidum on the CT with the fornix down here. On a coronal, I hope these are straight. Yes, I do. Part of the corpus callosum, more than likely the splenium. What's left of septum pellucidum, that V-shaped structure here would be fornix. Make sure you know these structures in here. The dark area is going to be the suprasellar cistern right above the pituitary gland. These two guys on end are optic tracts or optic nerves. The infundibulum right here is going to link the hypothalamus to the posterior portion of the pituitary gland. Back over here, we have the lateral fissure, and I believe they were looking for the insula back over here. So on this coronal. So we're not going to need to learn a lot of landmarks on the coronal. In fact, if anything, this area becomes kind of important to be aware of from that perspective. Questions on that? Okay, I'm going to shoot through this. Pineal gland, we talked about it. It's going to be near the roof of the third ventricle. You don't normally see it, but if you look back over here, here's the vermis of my cerebellum. Here's the splenium right over here. This is the region that's dark called the superior cistern. This is kind of the area that you would look for the hopefully calcified, well, let's see it better, calcified pineal gland back here. Here it is on this transverse MR, and you see it again adjacent to the third ventricle within that region called the superior cistern. Again, it's going to produce melatonin. We believe as individuals get older, it begins to calcify. Therefore, it reduces the amount of melatonin produced, and that sense of what's the word I was trying to find? Circadian rhythm in your body in terms of you're awake during the day, you're sleeping at night, is thrown off from that perspective. So patients who take melatonin, hopefully it remedies that. Here it is calcified on this patient. Okay, we've covered a lot of this before, so I'm going to skip out at this point. There's one more I want to show you. Yes. Okay, peduncles. Hopefully we've given you an idea of the peduncles that are found within the brain, which are nothing more than connectors, specialized motor fibers that connect one portion of the brain to another. The ones we've covered already were the ears of Mickey, called the cerebral peduncles. That's the first set, going from top to bottom. The second set is going to be oftentimes reaching around the fourth ventricle here and here, which is going to be the superior cerebellar peduncles. Then you have the inferiors right over here that are linking the medulla to portions of the cerebellum. The ones that are hardest to find because they're not really demarked with certain characteristics or features. Here and here is referred to as the middle cerebellar peduncles. That's going to connect basically the cerebrum and the part of the brainstem, the midbrain, to the pons itself. So pons goes back to cerebellum. These guys are more sweeping like this. Here, what's reaching around are the superior cerebellar peduncles and the inferior. The middle is kind of hard to pick up as a consistent landmark. But we have basically 4 peduncles. We have the cerebral peduncles, we have the superior cerebellar peduncles, the middle, which is seen adjacent to the pons, and then finally the inferior cerebellar peduncles. And the ones that we're going to have you focus on, the ears of Mickey, and these guys over here, and then the ones that's reaching around, which are the superior, reaching around the 4th ventricle, are the superior cerebellar peduncles. Okay? I'm going to kind of slide through this. All right, questions on that? Again, that was an introduction to the limbic system, probably faster, quicker than you like. What will be even more brief, if I may, cranial nerves. I want to give you, I want to make sure I don't neglect this part of the brain, but keep in mind that some of the cranial nerves are as thin as threads. There's 12 pairs. So oftentimes they will not stand out as real strong landmarks. The ones we're going to focus on would be like the first, you can see it on occasion, the second, which is the optic nerve, the 5th, called the trigeminal, because oftentimes it's involved with tumors and meningiomas. And then there's another one called the vagus, which we see it near the base of the skull. So from a landmark perspective, some of these are very tiny. This is an inferior-superior perspective, and you can see, if we go from top to bottom, oftentimes these will transition in at different levels. The biggest would be beyond the optic nerve with pretty good size. These guys right here are called the trigeminal. The trigeminals have 3 breaks in them that basically feed the facial area, the maxillary, and the mandibular area. There's some separate facial. Some of these, like the abducens, very tiny. They help with movement of the eyes. This one here, the vestibulocochlear, is going to help with hearing. This one helps in terms of hypoglossal for the tongue. This is a spinal accessory that helps movement of the neck and shoulders. Vagus is going to help us with things like digestion and peristalsis and things like that. So they all have a key function, but from a learning standpoint, they're really, really tiny. I'm going to run you through a series of all 12. Sometimes they're really hard to pick up. These images aren't the best. They come from Kelly. I couldn't find consistent, good nerve images, so I'm going to walk you through some of these. Here, and they're oftentimes denoted by CN1 through 12. Cranial nerve. What you see over here is the frontal lobe coming over here, and back over here is a thin linear line. That's going to represent the first cranial nerve, the olfactory. We talked about the bulbs are going to be embedded in the ethmoid bone. What's coming back over here is going to be the olfactory nerve. You can't really see it well on a coronal back over here, really tiny. So this one, on occasion, you'll see a small whisper of attenuation or a signal coming on your MR sagittal, which is the best image. That will represent the first cranial nerve, the olfactory, or smell. The ones that are perhaps the most dominant beyond the trigeminal is optic nerves. What you're going to have over here is coming back from the retinas. They're going to come straight back this way and this way, not to be confused with these rectus muscles. There's 4 sets of rectus muscles. We're seeing both the medial and lateral over here, which move the eye. But these guys back over here are going to come over and right into the area of the suprasellar cistern in the area of the, right above the circle of Willis. They're going to desiccate. So what happens is this cranial nerve is going to come back over here. It's going to cross over to this portion of the brain. The one on patient right side is going to come over, cross over, desiccate, and go to the opposite side. What we know about vision is that, we're always worried about this area through here for tumors. Sometimes you'll have pituitary tumors that will emerge, and that will obscure vision. But we also know that the primary visual centers are located in the occipital lobe of the cerebrum. So sometimes when patients take falls, get a concussion, get a bleed in this area, vision will be impaired because what's going to happen, you have what we call optic radiations that will carry these babies back like this. Again, they've crossed over in this direction in the area of the suprasellar cistern. They're going to be reaching into the occipital lobe for interpretation. These radiations sometimes can be involved by trauma, and patients will lose sight even though there was no immediate damage to the eyes themselves. So this area becomes really critical in terms of vision interpretation. It's one thing to see, The other part is being able to interpret what you see, and that oftentimes is what's going to happen in terms of damage to the posterior portion of the brain. Here's a hemorrhage that occurred on this patient back over here. That's when the arrows are pointing it out on these different pulse sequences of MR. And basically, the damage wasn't here, but rather back here because of whatever trauma it was, and the patient will lose the ability to interpret vision. Like smell, it's a learned process. Vision, somewhat of a different animal, but you have to be able to link what the eye sees based on how it's being processed in this portion of the brain. If you have an interruption between these two, you basically lose the ability to see. So it's not always related specifically to the optic nerves. The ocular motor is going to move basically the eyes in different directions, help us with the eyelids. These babies over here, this is what I was telling you about, the fine thread right over here. It's coming off near the area of the pons and midbrain. Back over here, you see it's a little bit better. Over here, it's a pituitary gland, and they're coming off at an angle like this. But these are going to basically, for the third cranial nerve, move the eyelid, move the eye in different directions. There's another one that we can't quite see yet called the abducens. We'll look at that a little bit lower down. But right over here would be the ocular motor. This is a real good image of it. Normally you would not see it that clearly. Trochlear, again, is going to help with movement of the eye. It's going to be perceived as the fourth nerve. Right over here, near the transition between midbrain and pons, a real fine thread over here. On this side back over here, let me see if I can find it. Trochlear is coming off somewhere in this neighborhood. And you have other nerves like the abducens and trigeminal. Again, I'd be misleading to say to you, this is where these nerves are found. These are consistent landmarks. This is not going to happen from that standpoint. The trigeminal is one that we're going to see emerge near the area of the pons. This one is important. And the reason it is that there's an opening and an extension of dura mater that goes along the base of the skull near the pituitary gland and the sphenoid bone. It's called Meckel's cave. Meckel's cave is nothing more than an area that's adjacent to what we call the cerebellopontine cistern on this side over here. And it's an opening right over here that's filled with CSF, here and here. What you have going through it is one of the largest nerves, which is the trigeminal, going right through it. Patients oftentimes, when they have issues in terms of facial paralysis, many reasons for it. It could be viral, it could be trauma, whatever the case may be. But they begin by looking on MR to see if there's any impingement of the nerve going through Meckel's cave. Here is the pons on this coronal perspective, and what stands out, this one that really stands out well, is the trigeminal nerve. So we're looking at it as it goes head on through Meckel's cave, which is again nothing more than an extension of dura mater and openings into this portion of the brain. So this one kind of stands out as a fairly consistent landmark. When you look at the trigeminal, it's really a big nerve. So what happens, as the term would imply, it splits into three. You're going to have it go through Meckel's cave. It's then going to trifurcate into the mandible area. There's another branch that will be serving maxillary, and the one that's going to be taking care of what they call ophthalmic zone or region. Over here gives you a different perspective, not the greatest. Meckel's cave over here, two branches are going to go through the cavernous sinus in this area, so you have that split right in this area. You have a meningioma trauma in this area, it knocks out most of the facial region nerve control. So they develop eye drop, they develop paralysis of the mouth, they develop many things in terms of facial features whenever you have an involvement. Here we have the Meckel's cave right over here and over here. The suprasellar cistern would be somewhere in this neighborhood. What you see over here, that seen on a transverse, is a large meningioma. So this patient will probably exhibit paralysis on one half of the facial region because of this large tumor, which hopefully can be eradicated. But again, the nerve is going to be greatly impacted by that. So the trigeminal nerve is one that's pretty important and pretty easy to pick up, at least on coronal perspective. Abducens is going to help with movement of the eye. Very tiny little nerve. Over here, let's see if I can find it for you, right over here. Threads. Here is pons, here is vermis, okay? Here's basilar artery right over here, clivus, and all you pick up is a small thread. So it can be one of many from that end. That's the sixth nerve. Facial is a branch actually coming through the same area as would be the trigeminal. It's this little guy right over here. And then they have another one called vestibulocochlear, which is going to help with a sense of balance and hearing. So some patients, we suspect when they have hearing loss that they have damage to the inner ear, or they have issues in terms of balance or equilibrium. We suspect it might be something like Meniere's disease, which alters the flow of fluid in the semicircular canals. What they're finding in some cases are small lesions in the area of the vestibulocochlear nerve, which is really harder to correct. So some patients never quite get hearing back, even through like ear surgery and replacement of the ossicles, things like that. They never quite get it back because the nerves are damaged. Spinal accessory, tiny, tiny nerve near the medulla is going to be the 11th nerve. Very tiny structures. They're going to help in terms of innervating the neck, shoulder area, so they help in that regard. Not really commonly involved. The hypoglossal, even smaller, is going to help with the roof of the mouth and tongue. As the term would imply, that's going to be the 12th nerve. So again, these guys really, the glossopharyngeal is going to take care of the tongue. Vagus nerve, which is right over here, and here it's the 10th nerve. That one is significant. As it moves through the base of the skull, it becomes larger in diameter. It controls things like peristalsis. It controls things in terms of GI function, diaphragms, part of a branch of the phrenic. And this guy here can be significant. So in some cases, patients who have irretractable pain, we sometimes will go through and actually cauterize or eliminate that portion of the vagus nerve, because it's the only way to really control that pain from that end. But the vagus nerve really is an important structure. We find it coming off near the area of the medulla, and that's it. Okay. The purpose of today's lecture was just to give you an introduction to what these nerves are. Here's what I'm going to have you do. You will not be tested on naming these, but keep it somewhere tucked away in your notes. As we go through these different lectures, whether it's testable or not, that's that's not really important. But what is that you have these resources to draw from as you get ready for your boards. Okay? All right, that said, what I want to do is go through our major landmarks as we had talked about over here. Same series we've gone through before. I'm going to walk you through these. Here's the game plan for today. And well, we're going to finish up today with a review. And for Thursday. I'm going to start off with a review of key landmarks, much like what we're doing right now. We'll have Jake start off with his presentation. What's the name of the condition you're presenting? Malaysia?
No,
Encephalomalacia.
That's it.
Encephalomalacia. So he's going to present a case like that, which is he's the first one to go out and do his project. Then I'm going to give you a practice assessment on Thursday. Based on how we do with it, then we'll make a prediction when we're ready for our brain test. I like to see where we're at on Thursday. How about if I leave it there? I won't go any farther until we get to that point. I'm going to walk you through these and identify some key landmarks as we do so. Please stop me as we do. And if you have questions, I don't know if I have another one here. I'm going to start off over here. Please stop me. Now what we have is all the key landmarks that we need to be aware of. So here we go. Cerebrum seen over here. I have gyri, which are the upfolds, downfolds, sulci, right over here. We have corpus callosum, the white band of white matter tracts over here, which includes the lower limb called the rostrum, genu, body, splenium. Lateral ventricle over here, thalamus larger, hypothalamus found somewhat inferior to it, and basically it's kind of vague over here. You're seeing, actually it's kind of poor, it's kind of coming back over here. Here's an optic nerve more than likely, and then back over here would be the area of the infundibula. Let me go back to this one for a second if I may. Brainstem better seen, okay? So over here we have optic nerve coming back this way. I have the three components of the brainstem, namely midbrain, pons, medulla, right through here. Little circular jobs right here are called mammillary bodies. We've seen it on a sagittal perspective. Midbrain, as I mentioned before, is here. There is a passageway that runs oblique. This is going to be called the cerebral aqueduct. It links the third ventricle that's being obscured by the thalamus with this diamond-shaped guy back here, which is the fourth. Here, we're going to have, although it doesn't show up really well, this little thin gray line is going to be a dural covering called the tentorium cerebelli. What's above it, over here, is straight sinus. Since we're talking about sinuses, coming off this way, up and over is right through the longitudinal fissure. Coming straight back this way is superior sagittal sinus. Where the straight sinus meets the superior sagittal sinus, you're going to have confluence of sinuses. We'll look at that on a transverse as well. Vermis, as I mentioned before, up here, what's found below it is going to be the cerebellum. My friend Clivus over here, and just getting a small hint along the pontine cistern over here is going to be the basal artery. So the basal artery will be found best seen, I should say, between the pons and the clivus. So a tersica over here. Anything I'm missing on this one?
I think so.
Is that pretty much the majority of it? A lot on the sagittal. Okay, this is just a different perspective of it. Pretty much the same landmark. This one shows a little bit better detail of things like the tentorium cerebelli. It separates the posterior portion of the cerebrum from the cerebellum. How many lobes are there that make up the cerebrum?
5.
Okay. What is the hidden one called?
Insula.
Insula. See? Already you're talking the talk. All right. Right off the bat, we're going to be in the upper cerebrum. I'm going to always take you from top to bottom. I encourage you to learn them from that standpoint. Right through here, we have the two hemispheres of the cerebrum, but what's dividing them is the longitudinal fissure. You can call this one of three. We can call it longitudinal fissure. I can call it falx cerebri, which is the double layer of dura going through the midline of it, or we call it a portion of the superior sagittal sinus. All three of these would be right. You have a little white matter, gray matter, nothing more significant than that. As we work our way down, we go down one more if I may. Over here, we have a burst of white that you need to be aware of. It perhaps is the only landmark beyond this guy right here, which is going to be called centrum semiovale. So this area here, somewhat of a butterfly shape, for metaphor, here it is over here. Centrum semiovale is nothing more than a vast collection of white matter tracts that eventually will carry impulses down to the basal ganglia. Longitudinal fissure, falx cerebri. Right here, running along the posterior midline, will be superior sagittal sinus. So you don't have a lot of landmarks on this. So just maybe three that stand out from that end. Going down, here we're getting early signs of lateral ventricles. Key landmarks include part of the corpus callosum, genu, splenium, a little bit of the body over here, it looks kind of fuzzy, just beginning to transition into septum pellucidum, lateral ventricles. The first of the basal ganglia in the form of what runs adjacent to it, which is the caudate nucleus. Going from anterior to posterior, we will have head, body, and tail of the caudate nucleus. This triangular shaped defect will always, whether it's going to be a flow void artifact, in this case you have a different pulse sequence, will always represent the superior sagittal sinus going directly down the midline.
It's not the confluence yet.
Not yet, sir. You have to get down to pons level before you really pick it up. It'll look like it's exploding. Whereas this one has a nice, well, within reason, a triangular shape, whether it's a flow void or this. When you get into confluence, it's kind of all over the map. And we'll show you that here in a moment. Good question. More of the lateral ventricles over here. Now we're getting a consistent septum pellucidum, once again splenium posterior, genu anterior, caudate nucleus here, not as easy to see, but over here as well. Whenever you see white within the ventricles, what's that going to represent? Choroid plexus, which is going to be the specialized capillary beds that produce CSF. So here, a handful of landmarks for you to be aware of. Genu, splenium, Septum pellucidum, caudate nucleus, head, body, tail, head, body, tail, and then again, triangular shaped superior sagittal sinus. Transition going on here, okay? Now we're getting into specific horns. We have anterior horns over here, posterior horns, the lateral ventricles, just starting to transition eventually into the third ventricle. Anything that looks like spaghetti within the ventricles, once again, is going to be chord plexus, splenium, genu. Now, specifically, what part of the caudate nucleus is this? Right here and here. Head. So you have the head right over here. See how this guy's just starting to transition in here, a little bit here. That's the first glimpse of lentiform nucleus. Coming between the two is internal capsule. Outside will be external capsule. From a landmark perspective, things that you need to be aware of: genu, horns, anterior horns of the lateral ventricles, head of the caudate nucleus. We won't worry about the third yet. Chord plexus, posterior horn. Come back this way, part of the longitudinal fissure, but that triangular shaped defect, flow void, will always be superior sagittal sinus. On the CT doesn't show it. It's in great detail from that end. All right, now we're getting more transition. Now we can say a couple things to transition in. What's left of septum pellucidum, diamond shaped, is going to be the beginning of the fornix. Over here, we have head of the caudate nucleus adjacent to the anterior heads of the lateral ventricles. Lentiform nucleus seen over here. Keep in mind there are two components of it. The medial one is called globus pallidus, and the lateral one is called putamen. Putamen, yes, thank you. All right, over here, midline structure, third ventricle, right through here. On either side of it has to be, even though we don't clearly see it yet, it has to be the thalamus. It's going to form the lateral wall of the lateral ventricles. Triangular shaped defect, superior sagittal sinus. Just starting to get into the fissures on the lateral side right over here. Okay, still in the upper, well, more like in the cerebral level over here. Getting closer to midbrain, but not quite there yet. On the coronal, make sure you know these major landmarks over here. It would be corpus callosum. We can't tell which one this is, but look at this little V-shaped structure. This one's going to be the fornix. Here, B labeled, is going to be the caudate nucleus, specifically the head. Internal capsule, kind of a cool looking image here. And here, lentiform nucleus right over here, made up of globus pallidus and putamen. We have pons. We get into hippocampus, which is not as important. Third ventricle is just starting to show up where F is on this image. Going down, same as before, same structures, nothing really different from what we saw earlier. Let me jump down, okay? Third ventricle right over here. V-shaped structure, fornix over here, a little bit, maybe the mammillary body starting to show up. We can't quite see them yet. These are the posterior horns, the lateral ventricles. This is a communication between the posterior horns of the lateral ventricles and the temporals that we don't see well, called the antrum, right over here. Kind of where you're looking for, sometimes if it's calcified, the area of the pineal gland. Still, triangular shaped superior sagittal sinus. Beautiful pineal gland right over here. Okay? Still, superior sagittal sinus. This one's kind of transition. Over here would be the area of the insula, back over here, and over here as well. Go down one more if I may. Midbrain, this one's rich in content. Here's what we're going to have on this one. Ears of Mickey, cerebral peduncle. Midbrain behind it. The mouth of Mickey, cerebral aqueduct, linking third to fourth ventricle. The chin of Mickey is called the tectum, which I should have pointed out on the sagittal. These are the two little superior and inferior colleculi. V-shaped structure now is not straight sinus, it's maybe a little bit over here, but it's the tentorium cerebelli. Here is the vermis right between the two. So when I see this wishbone-shaped structure with the somewhat combination of white and gray matter structures that run in this direction, that's vermis. So we have vermis here, tentorium cerebelli. This guy's beginning to go through transition. We'll kind of keep an eye on it as we work our way down. Here, this area right through here is called the suprasellar cistern, that dark area right over there. We have the two mammillary bodies seen here. These are the two little dots. Cisterns, which we'll see maybe better on the next one, but we're going to point them out right now. I talked about the suprasellar cistern. It's important to know that. Between the ears is called the inner peduncular cistern. Along the cheeks of Mickey is called the ambient cistern. And then the one that's found between the vermis and the tectum is called the superior cistern. So the ones you have to be aware of: suprasellar, inner peduncular, back over here, ambient along the side of the midbrain, and then this one between the vermis and the tectum called the superior cistern. A lot of spaces, but again, pathology can occur or hemorrhage. You at least have to be aware of what those structures are. Okay. Let me jump ahead. Transition zone, let me move down over here. Pons level. Pons key structures. Bone is clivus, which we saw more triangular on the sagittal. The dot, normally it'd be a flow void artifact, is going to be the basilar artery. It's going to be found between the pons and the clivus. Pons itself right through here. Fourth ventricle, which whereas before was a singular round dot, which is the cerebral aqueduct, it becomes larger. What you need to be aware of is these arms that reach around it. Please note these as being superior cerebellar peduncles. Vermis is more generous over here. Look at that explosion of blood back over here. This is the internal occipital protuberance. It's kind of a loosey-goosey landmark, but when we see it come off like this, we kind of expect what has happened. And I kind of neglected you before, so let me go back one, if I may. Here's the straight sinus coming down, so I didn't really point that out very well. What's left of tentorium, vermis, and you get that little flow of blood back here. It's running somewhat downward, is going to be the straight sinus. When it meets up with the superior sagittal sinus, in this case, you get the confluence of sinuses. It's where the straight has met the superior sagittal sinus. Again, that internal occipital protuberance right over here will give it away. Temporal lobes of the cerebrum, reaching that far down. Once again, clivus, basilar artery, pons, fourth ventricle, superior cerebellar peduncles, vermis, confluence of sinuses, and when I neglect temporal lobes, there's something else I forgot to tell you. Oh yes, over here, that dark area right through here, pontine cistern, and because they have the trigeminal nerve going through it, this is called the cerebello-pontine angle, or CPA, going in this area right through here. Once again, it's important for hemorrhage and bleeds. Just be aware of it. Finally, medulla. We have actually one more after this. The medulla, the lower portion of the brainstem. You're going to have these two extensions of tissue that go posterior. Keep in mind, these are called inferior cerebellar peduncles. In the middle here is the vermis, what's left of it. We didn't get into anterior lobes. Basically, that's what these are. We'll get into those later on. We won't probably. Here is the cerebellum. And at this point, what we have now coming off this way and this way, either as a flow void artifact or as what we see in terms of bright signal based on our pulse sequence, is the transverse sinuses. I think we might have seen them earlier beginning to emerge over here. A little bit of a taste over here and back over here. Part of the flow of the transverse sinuses going down. Farther, these guys are over here. Now the temporal, the petrous bone is going to be laying at a 45-degree angle right about there. As we go down, they make an S-turn like this and like this. This is the sigmoid venous sinus. What happens is the blood will go through the jugular foramina, and at that point below, they become the internal jugular veins. Anterior portion of the foramen magnum, forgot for a moment, sorry about that. These are cerebellar tonsils, right through here, these little guys, and back over here is the last cistern called the cerebellomedullary cistern. All right, so tell me, how are we doing? Bad, I got a thumb down?